All right, welcome everyone to today's HealthLinks webinar. My name is Kaylee Rivera. I'm the Community Engagement and Training Manager for HealthLinks. I did want to quickly mention that as most of you or those of you who are in Colorado know, we are having a very intense blizzard outside, and so I've seen my lights flickering and the internet is in and out, so I apologize if anything happens during the middle of this webinar, but I will try to quickly relaunch as soon as possible, but here's to hoping that nothing actually happens along the way. So today we have a really great topic, integrating well-being and work, and I'm excited to have Cha-Cha on with us today from NIOSH to present that. As many of you know, HealthLinks is within the Center for Health, Work, and Environment, and we are a funded center through NIOSH as a center of excellence in total worker health, and HealthLinks is really our practice arm of the center. And so as you'll hear today, all of her related examples and what is total worker health relates directly to all of our benchmarks because we're trying to implement total worker health in the community. A few more housekeeping items. We will be keeping everybody on mute throughout the duration of the presentation, but feel free to chime in with questions using the chat box. I'll be monitoring that, and we can ask those along the way or share, save them till the end, kind of depending on what the question or how the presentation is going. As a reminder, we are recording this webinar, and so it will be linked to our HealthLinks Online Resource Center as well as our YouTube page, and the link to the recording will also go out to you all in the follow-up email that I'll send out shortly after the end of the presentation today. And hopefully for those who couldn't make it, maybe due to the storm, they will be able to access it through that recording. And I wanted to point out that if you were interested in collecting SHRM credits today, we have decided to make this webinar free to get your SHRM credits. So in the email that I'll send out after this, you'll just click the link to the form, a quick survey to fill out, and then it will give you your SHRM activity ID. So please, take advantage of that and collect your SHRM credits. All right, so as I mentioned, I'm excited to have Cha-Cha on with us today. She is the coordinator for partnership and new opportunity development for the Office of Total Worker Health at the National Institute for Occupational Safety and Health, and that is within the Centers for Disease Control and Prevention. She coordinates a task with RAND to develop a framework and assessment tool for worker well-being and collaborates with stakeholders to share research and promising practices related to advancing total worker health. So Cha-Cha, thank you so much for being on with us today. I am going to actually stop sharing my screen and allow you to share yours, and I'll let you kind of take it from there.
Great, thanks a lot, Kelly. I have the, I'm going to go back and figure out how to share my screen. Share. Just only, oh, we did this earlier. It was very easy, and now it's a little confusing. Let's see. Earlier, I was able to share it by just clicking on share, and I saw the slide I wanted to share. But now all I see is, well, I'll just share the screen, and hopefully that works.
Perfect. I can see that. Thank you.
There you go. All right. It is a pleasure to be here. Thank you so much, Kaylee and HealthLinks for this opportunity to share the latest with the latest about total worker health with your stakeholders. We really appreciate the interest from everybody. Please do reach out if you have any questions or want to follow up in any way. I'll dive right into it. How does work relate to well-being? Well, we certainly can find good entertainment from it. There's good movies and TV shows that could give us well-being because we enjoy watching it. But while bad workplaces can be good entertainment, it's really not amusing when it happens to you personally. Right, and this slide just shows, a couple of not good supervisors. We certainly know supervisors could affect well-being for the worse. Even if you have a dream job, you would actually consider quitting it because the supervisor management isn't good. And that has been shown in studies. So that's one easy way to think about how work affects well-being. In addition, to think about how your coworkers affect your well-being, whether you feel like you're contributing to an important mission, whether you have confidence in your abilities and feel appreciated by everyone on your team and customers. We know that 75% of US employers say that stress is their #1 workplace health concern. You know, we think a lot about obesity, the obesity epidemic, or even smoking, but stress has actually been identified as the top concern. And how else does work affect well-being? Well, what the American Psychological Association found is that chronic stress is linked to many of the leading causes of death. And then I'm going to go through this and think about how work relates to it. Heart disease is a leading cause of death. And how does heart disease relate to work? You know, stress, exercise, food, also chronic lung disease, and we could certainly get exposures from work. Accidents, and that could happen if you're tired at work. Cancer, again, think about the exposures. And when we think about these public health concerns, you know, people talk about fast food and driving and the lack of walking trails. Think about applying that to the workplace. Do you have access to these things at work? And what does your work environment look like when we're thinking about general public health concerns? Those are some of the traditional issues related to health. There are also many things coming up that we are focusing on when we talk about the future of work and how we need to really prepare for protecting worker safety and health in the future. One is the trend toward contract and contingent or precarious employment, that is temporary work. And this could be good. It could give us more access to affordable work. It could give us convenience. You could access even doctors and lawyers easily. You know, people talk about Uber and Lyft, but you can see that this is really hitting all the different industry sectors beyond what people usually think about. And what's the impact of this? Well, there is less job security. People who are on contract work or precarious employment are not sure if they're going to have a job in the future. And what does that do for your mental health and the stress that we just talked about? And they're more likely to lose their jobs if they get injured, because of course you could just hire someone else. And they're more likely to have lower incomes and fewer benefits. Precarious employment means less potential for advancement. Are workplaces going to invest in training for workers if the workers are not there full time? And precarious workers are likely to be given the more dangerous jobs. 37% of temporary workers, the largest segment, have jobs in manufacturing and other hazardous industries. Precarious workers have up to twice the risk of on-the-job injuries compared to traditional workers. And think about what we just talked about. That could be because they also have less training, right? And what happens when they get injured? Who is responsible? Is it the employer on site, or is it the paperwork employer who does the processing of the paychecks? Who has responsibility for that? Do they have access to health insurance? If so, who provides it? Do they have representation by unions? And maybe it's because they don't have representation by unions that they are in a precarious employment situation. And the people who are more likely to be given precarious jobs are vulnerable populations, such as younger workers, older workers, people who do not speak fluent English, women, people who may not understand their rights and protections that they have in place. Another trend toward the future is what you've seen in the news a lot: artificial intelligence, automation, robotics. Again, I want to point out that it's not just in when you think about, you know, like the manufacturing jobs. You see on the slide, AI is really hitting all different sectors, making movies, art, and that article on the right shows an example of an article that's written by AI. because for sports stories, you just need the numbers, right? And it's also hitting finance and law too, because for legal research, you just need data, a database of all the legal decisions. For financial analysis, you need lots of numbers, and all those things can be automated. There was one study that looked at the potential for automation for jobs in the US, and they identified, activities that are more likely to be automated and activities that are least likely to be automated. Managing people, applying expertise, dealing with stakeholders. Those are some of the the type of jobs that would be less likely to be automated. And there's been a study that found that over the next few years, each worker is going to need hundreds of hours of training to be prepared for the work of the future. Related to that is technology. There's small, simple things like Fitbits, which we have right now. What does that mean in terms of privacy? If you have a Fitbit through your workplace, it's free. You participate in walking challenges. That sounds good. It is nice, but as they get more sophisticated and start measuring our heart, our sleep, even our literally physical activity, where we are at each moment in time, what does that mean for privacy, and how do workers feel about that? Another example is something that I think is pretty pervasive. The systems that show you if you're in the office, out of the office. Again, very helpful. I definitely appreciate it. But this could be used in a negative way if someone's really engaging in unhealthy and overprotective, overindulging in monitoring of employees. There's one colleague who said that her daughter, when she's gone from her desk for more than 5 minutes, her supervisor finds a way to contact her and really want to make sure she's there. And going back to the first slide when we talked about the supervisor, what does it mean when your supervisor is an automated software program, an app? Do you have someone to contact? Do you have a way to do performance reviews? These are all issues that we're trying to grapple with as we look toward the future. And continuing to deal with trends, workplace safety and health risks that are still occurring. One is sleep and shift work. That is a major concern. I saw that many of the participants on this call are from healthcare facilities and some from manufacturing. So shift work and being sleep deprived is definitely an issue. The World Health Organization, way back in 2007, identified shift work that involves circadian disruption as being probably carcinogenic to human beings. Studies have shown that shift work is related to body weight, and long work hours is related to sleep deprivation and negative health outcomes. Just last month, the National Safety Council released a report about fatigue. They estimated that an employee with sleep problems can cost $3,500 a year in lost productivity and absenteeism. And what does that mean? Well, they also found that 97% of workers have at least one workplace fatigue risk factor, and more than 80% have 2 or more risk factors. And they say that the National Safety Council points out that drowsy driving is basically impaired driving. When we talk about drunk driving, we don't let people drive when they're drunk, and yet we let our friends driving down the road when they're sick, and we let our coworkers, our colleagues, drive when they are sleep deprived. You could be 3 times more likely to be in a car crash if you're fatigued, and the National Safety Council says that being awake for more than 20 hours is the equivalent of being legally drunk. Still comparing work-related exposures to risks that we recognize, this slide shows the results of comparing workplace risks to secondhand smoke exposure. That's something that we always talk about, but we don't talk about the psychosocial working conditions, which could be more hazardous than even secondhand smoke. On the left, it shows the different risk factors that is related to physician-diagnosed health conditions. And on the right, it shows risk factors associated with self-rated poor physical health. and look at the things, low organizational justice, high job demands, exposure to shift work, unemployment, job insecurity. These are things that organizations, employers can really influence, just like they can influence secondhand smoke. And another trend that I've touched upon is the aging workforce. The Bureau of Labor Statistics just last year estimated that by 2026, about 1/4 of workers will be 55 and older. NIOSH created a National Center for Productive Aging to consider these issues. And we call it productive aging because we're not just concerned with older workers, we're concerned with the entire lifespan and how that affects different types of changes and everyone working together. We could definitely have 5 generations, including Generation Z. And what does that mean in terms of management and workplace culture? One final hot topic of concern is opioids. How is this related to work? Well, often people start using opiates because of injury from work, and it could be related to risky workplace conditions, slips, trips, and falls, which is one of the top concerns for workplaces. And also, it would relate to job insecurity, having high demand, low control jobs, hazardous jobs. Those are the ones that are more likely to be at risk for opiates addiction. On average, 115 Americans every day die from an opiate overdose. So that is something that we're really trying to get ahead of at NIOSH. But there is recognition of the importance of all these different issues, and that's the good news. Everyone's really working together to address the future of work and how we could tackle this. Just in December, the National Academies of Science convened a meeting reorienting healthcare and business investments toward health and well-being. They highlighted a new concept of value. The old value is based on the organization and maximizing profit. They define the new concept of value as to put people's goals and needs at the center, recognizing that to unlock our potential, investors must reward businesses that enable people to thrive and withdraw resources from those that are harmful. So that is very good that there's recognition of this as we tackle these new challenges. A few years ago, in the Journal for Occupational Environmental Medicine, they published a study outlining the importance of linking workplace safety and health protections and programs to actual measures of the success of the company. Another example is an initiative that the Vitality Institute initiated, which was to encourage companies to look at health metrics of workers when they're reporting on themselves. So we don't just report how many widgets we produce, we're also reporting on how we're treating our workers. All of this fits with the priorities of the current Surgeon General. He has linked community health to economic prosperity. And so it's really good that this is the way to the future, recognition that all of this is related. So bring it on, future. We are ready for you. And we think one key way to do this is through the total work health approach. I will now go through the total work health approach. It is a long definition. I broke it up into different pieces. The definition that we use for total work health is policies, programs, and practices. What that means is everything, basically everything. Not just written policies and programs, but practices. That is what happens in real life. We all know that there's written policies, but how it gets implemented is something different. So we want to cover that. We take an integrated approach, and we've prioritized protection from workplace safety and health hazards. So that's the first thing. People need to not be injured. And we integrate that with prevention efforts related to health. And the overall goal is to advance worker well-being. We are ambitious. Our vision is for work to be a recognized means of achieving well-being. This is very comprehensive. And this slide gives an example of the different approaches that we want to take. The centerpiece right in the center is control of hazards and exposures. So that's the first thing. We want to make sure people aren't getting injured. And then we could deal with the different other aspects of well-being. And you can see the puzzle pieces. It relates to many of the things I've already touched upon. New employment patterns, organization of work that relates to autonomy, flexibility, compensation and benefits, leadership and culture, community supports, what's going on at home and in the community, the built environment, changing workforce demographics, and policy issues. All of these I've touched upon, and we're going to apply them coming up soon. For those of you who are in occupational safety and health, you know the hierarchy of controls. That is basically the idea that the way we want to prioritize safety and health protections is at the top of the hierarchy. The first way we would like to do that is to eliminate the hazards. Let's say for asbestos, the best way to not have asbestos disease is to not have asbestos, period. That is the best way. And if you really have no choice, then you could substitute it with something else. And you see at the bottom, the last resort is personal protective equipment. That means that if you really have no choice but to be exposed, then we would give you personal protective equipment. A good example of that would be firefighters. Their job is to run into a burning building. You can't tell them not to do that. So we give them personal protective equipment. But that is the last resort. The first priority is organizational level changes, and the last is individual change. And we would apply that to health too. The priority would be to make systems level changes upstream, basically addressing the social determinants of health in the workplace. And the last, and yet and still a piece of the puzzle, is to have individual change. But the point is we want to make changes at a workforce level if possible, rather than rely on individuals to make changes, because that is certainly difficult. Just a few key points of what total work health is not, just to be a little more explicit. I've talked about what total work health is. What it is not is we wouldn't want to blame the worker. We wouldn't want to say, oh, the reason you are sick is because you did not exercise. We wouldn't want to discriminate against people with any health conditions, and we wouldn't want to have perverse incentives that not everybody can access. And this is not just a health promotion program, because we really focus on organizational level changes, looking at the social determinants of health. A couple of examples of total work health approach. When we talk about musculoskeletal disease, which is a top issue in many workplaces, one way to do that is to reorganize work so that people could take breaks when they need to, and they're not engaging in repetitive motion. The second one is psychosocial health. That's another approach. Studies have shown flat out that people with musculoskeletal disease can heal faster or slower depending on the stress that they're facing. And then, of course, there's ergonomic consultations and self-management strategies. So you see this as a multi-pronged approach to addressing an issue, and not just focusing on, let's say, the approaches on the right. Another issue is sleep and fatigue, which I've touched upon. Top level intervention would be safe staffing so that people are not overworked. Another approach is supportive policies so that people could take a break if they need. They have autonomy and flexibility to do that. A third approach is, of course, to have a physical environment so that people could rest if they want to. And then there's sleep education, talking about sleep hygiene and resting and all the things that we hear every day. These two are examples of multi-pronged approaches to issues that we've talked about that I think are very common in the workplace. But I encourage you to think about your approach at your workplace and whether you're looking at particularly the things on the left. This is a slide of nails. I think you've heard of the phrase that, if you have a hammer, then everything looks like a nail. And if we're just taking one approach, if the people on this call are, let's say, HR professionals, then you're going to be looking at it through your lens. But if you could get your colleagues from other departments, whether it's workers' compensation, return to work, risk management, or health promotion, occupational health, if you're all talking together, then you have more than one tool in your toolkit, and you can start identifying different types of problems and different solutions. And that is an example of an integrated approach. This is a big slide you can look at your leisure. It is based off of the puzzle pieces I showed you earlier. It breaks out each of those pieces into a lot of many different topics. And this is just to point out the different opportunities you have to address worker well-being. We think about one or two issues as being the top priorities, but also consider the different prongs, the different tools in your toolkit to address it. And this slide shows how you could potentially do that. Now, we've talked about worker well-being, and that is in the definition of total worker health. It ends with the goal of advancing worker well-being. But what exactly is worker well-being? NIOSH has worked for the past few years with the RAND Corporation to create a definition for worker well-being. We found that in the literature, there wasn't actually a consistent definition. There was research on well-being in general, but nothing specific to the workplace. And we thought it was important to really define this and start a way to measure it so that we could know what we're talking about when we say we want to advance worker well-being, and we could know if we've actually influenced it. This is the long definition. Again, I'm breaking it up into different pieces. I'll explain this first, and then we'll go through the different domains. And the idea here is that when you're thinking about worker well-being at your workplace, these are the different domains you can consider tackling to improve the workforce well-being. It is an integrative concept. That's a word you've heard many times here so far in the webinar. It characterizes quality of life with respect to individuals' health, that all makes sense, and work-related, environmental, organizational, and psychosocial factors. And those are key issues. It's not just an individual's health, but all the things that could influence it. It is the experience of positive perceptions. The point there is, as I stated earlier, we don't just think of work as being potentially harmful. We want to recognize work as potentially being helpful. So positive perceptions, and perceptions gets at the idea that it could be subjective. There's a subjective component to it of how you feel about it. And the presence of constructive conditions. So that's the objective component. It's not just subjective, objectively, and there are things that actually influence your health regardless of how you feel about it. And we care about it at work and in other areas of life. And the overall goal is to enable workers to thrive and achieve their full potential. Now we'll go through the domains and use this as a framework for thinking about worker well-being. The first one, just as I've said before, is the physical environment and safety. This is the physical features of the work environment. And again, we're trying to be not just avoiding harm, but really improving health. And there are a couple of voluntary standards. They're on the slide on the left as well, certified. One standard, the other standards on the right, that was developed partially with CDC. And they look at the how the physical work environment impacts health. You can see the different issues that are listed. Community health, it reduces morbidity and absenteeism. And the International Building Institute, which is the one on the left, they break it out into a few different concepts: air, water, nourishment, light, fitness, comfort, and mind. And think about your workplace and how many of those you're addressing and how you could actually include more. That is the physical environment domain of worker well-being. Now we're moving on to the second domain of worker well-being. That is work evaluation and experience. As I said, this is a subjective component to it. And we thought it was important to include this because no matter what you have at work, what cannot be forgotten is how you personally feel about that. Maybe there's a difference in opinion, but your opinion does matter. So having this subjective component was critical to make sure that there's a comprehensive and holistic approach to the framework of work well-being. What's listed on the slide are the factors identified by the Mental Health Commission of Canada. They developed a voluntary standard for the workplace. And I just think it's so fascinating the things that are on here. Look at the bottom, the minimum human needs and mental health at work. They actually identify this as minimum human needs that you need: physical and psychological safety, self-worth, self-esteem, social justice, self-efficacy, accomplishment, autonomy, belonging. How many of us really think about that when we're thinking about our worker safety and health? We're sort of already moving on to other things. We haven't even established the very basics, the very minimum human needs. I think it's fascinating that they actually included this, which almost seems like it should go without saying, but we know that it does need to be said. And then on top of that is the workplace factors. And this is what we refer to generally as the organization of work in the puzzle piece I showed you. It touches on job demand, job control, reward, perceptions of reward and fairness, the support that you get. This is a volunteer standard in Canada, and related to the subjective component is, of course, how you feel about your workplace. And as I've said, work stress is a major issue. This study by SHRM identified the top 5 workplace stressors: low salary, low opportunity for growth, too heavy a workload, unrealistic job expectations, long hours. I want to point out that these are things that are really at the organization level. There's not much that individuals can do about this, but these are the the things that individuals identify as being stressful at work. And when we talk about the cost of programs, you're in HR, you're reporting to your superiors, or you're in a occupational health program, you're identifying programs. We talk about return on investment and all that. None of these things, addressing these things may not cost anything. Okay, low salaries, that'll cost something. But the workload, the opportunity for growth, job expectations, those are sort of culture level management kind of changes that don't have to cost anything. So when we're thinking about the investment to make in our workforce, we could really reduce our worker stress without necessarily costing anything. And what is the impact of all this? There's a lot of impact that leaders can make. This slide shows actual dose response effects of leadership support. The more supportive the senior leadership, the more improvement in health risk. The more supportive the senior leadership, the more reduction in medical care costs. This is directly related to the work stress issues that were identified in the previous slide. And we know that there is a lot of interest in this. I had talked about the Canadian voluntary standard. Also in September in the UK, Prince William launched an initiative called Mental Health at Work. So they have a lot of resources on ways to address the psychosocial work environment and how leaders and management can really help them. The next domain of worker well-being is workplace policies and culture. We've finished talking about the subjective component, and now this is the objective component, the actual policies you have in place. We know that providing flexibility and autonomy improves employee satisfaction, reduces turnover, even improves customer interactions. That is an example of how we could impact the business outcomes by improving the happiness and well-being of workers, not just through the things you think about of course, creating better products, but say in the healthcare environment, patient safety is important, but patient safety is linked to the safety and health of the people who work in the healthcare facility. The next slide shows examples of policies. This touches on the autonomy and flexibility that we had talked about earlier. People need to feel like they are able to meet their personal needs and workplace needs. A third of workers have difficulty adjusting their work schedule to deal with personal matters. And the third also say they have no ability to change their work hours. Again, there are times when that is necessary. I mean, if you are facing in a customer-facing position, or you are in a standard schedule of shift work. There are things that are difficult to change, but then we would then recommend that you consider improving the culture so that when there is a good work environment, you can actually do something about it. Looping back to what we had talked about regarding long hours, that is a workplace policy, right? I mean, yes, you could ask people to get more sleep, but you could also see what we could do in the workplace to address the long hours. There is a dose response effect. One study found that working over 32 years of long work hours was linked to heart disease and non-skin cancer, arthritis, and diabetes. And the dose response was that if they worked more than 60 hours a week, the risk was, they had 3 times the risk, and the risk was greater for women. Each year, short sleep duration among the US working population accounts for over $400 billion in cost to the economy and 1.2 million lost work days. That is an example of policies at work that we could influence directly instead of relying on people to make individual behavior change. More on policies, more examples of policies. One of the findings of the Britain's Healthiest Workplace is that employees with flexible hours and the ability to work from home reported lower absence and greater job satisfaction, and consider themselves to be in better physical and mental health. And those who have inflexible hours and are really working physically locked into the office and have a longer commute reported less good health outcomes. We also know that just because you have a policy of like vacation time, or you have a policy of being able to take off when you want to, it doesn't mean you're really disconnected. That's an example of how the policy may not match with the culture. I would generally ask at this point, how many of you actually use up all of your vacation time that you are allotted? How many of you, even when you're on vacation, check your email? How many of you check your email on the weekends? That's an example of how the policy may be one thing, but the actual practice is different. A RAND report found that lack of sleep, financial concerns, unpaid care to family members is negatively associated with productivity, and that workers reported being subjected to unrealistic time pressures, and all of this is related to higher levels of presenteeism and strained relationships at work. And being able to align your culture with your policy is key to having worker well-being. This is a report by the OECD, which outlined different programs in different countries. Austria is just one example. Other countries do this too. They actually identified as a risk factor for safety and health the lack of social support or feedback from line managers, unclear or conflicting work targets, job monotony. They actually outlined these as risk factors for psychological work strain. So this is really moving beyond, traditional safety issues that we think about, and it's definitely not just telling people that they need to become more resilient. It identifies these workplace interventions of providing more social support, getting feedback from line managers, having clear work targets, having less job monotony. Those are policies that workplaces can take related to the worker well-being framework. The next domain in the worker well-being framework is actual health, the individual health status. Again, this is not just up to the individual. We look at what are the systems in place that matter. As I said, even for something like musculoskeletal disease or neck pain, we found that neck pain, which seems to be a individual health issue, it was more common among workers who reported one or more psychosocial and organizational risks in the workplace, and that the risks are work-family balance, exposure to a hostile work environment and job insecurity, precarious work arrangements, multiple jobs, long hours. So even for something that we think is just directly up to the individual, it may not be. The next two slides show differences among occupational groups for health conditions. This one is about cardiovascular risks, and you see that the ones with the worst numbers are police and firefighters, service occupations, and the ones with the best numbers are sports, entertainment people. One way that we like to discuss this is for the police and firefighters. They have some of the worst heart disease risk factors. And the next slide is for obesity. Again, same thing. You could see the ones with the occupational groups with the highest prevalence for obesity are police and firefighters, social workers, and the office workers, actors, athletes have the lowest prevalence for obesity. So the question is, do you think when there's a job opening for a police officer, do you think that the people who are applying for those jobs are just more obese? Do we think that there's something about those jobs that attract people who have obesity? No, right? That can't possibly be. They probably start off as people within the bell curve, and then over the course of their careers, they develop the cardiovascular risk and increase the prevalence of obesity. That's a great way to demonstrate how this is related to work. I was just at a meeting last week, and there was a company it was a transportation company, and their workers were like bus drivers, and they have uniforms. And when they're giving people their uniforms, when they first start off the job, the people will say, oh, I'm a size, whatever, 6. And they'll flat out tell people, well, that's what you are now. Once you start the job, you're probably going to gain weight. So you should get a uniform that's a bigger size than you currently are. That's an example of how this really happens through your job. So even for something like health, which seems to be individually based, what can we do to really help people with that? The last domain of worker well-being is the broader community, the home society. And I've touched upon that earlier of how companies are becoming more interested in this. This is a report by a group of organizations, including AIHA, NIOSH, the Center for Safety and Health Sustainability. They recognize that organizations should consider workplace safety and health as material to their stakeholders, and they're really working to improve reporting, and they're going to try to make recommendations on metrics related to worker safety and health that companies would want to report on, so we can better understand how companies are treating their workers, related to the Vitality Report and JOEM report I talked about earlier. And related to the National Academy's quote about a new concept of value, there is interest in taking a long-term perspective when we're looking at outcomes. And this is very important, particularly for health, when it's going to take you a while to see actual health improvements in health metrics and health outcomes. So taking a long-term perspective would be important instead of just looking at the short-term numbers. And it is good that there is more interest in these things as we look toward the future and future challenges. I've discussed, let me just sort of summarize, we've discussed total worker health, we've discussed applying it using a worker well-being framework. I'll wrap up with a few thoughts, and we will then have time for questions. I've talked about a lot of things, but we did manage to distill total work health into 5 essential elements. This is on our webpage, but I'll go through them now just to summarize succinctly the 45 minutes. Demonstrate leadership commitment. I've expounded on that a lot. Design work to be safe. That's the first thing we've talked about. get support from workers so that where you have worker buy-in, that's a subjective component I talked about. We need worker engagement, and we need to know how workers feel. And to do all that, we need confidentiality and to protect the privacy of workers. That touches upon one of the things I talked about of what total work health is not. It does not discriminate. It's careful about incentives. And the last one is an integrated approach, which relates directly to the confidentiality and privacy and having input from workers. You would want to make sure, if you're going to have an integrated system, that there is privacy protected. Basically, we want to ask ourselves, how would our workers answer these questions? How do they think their workplace feels about their health? Does this job make me healthier? Are visions for work to be a recognized means of achieving well-being? Can my workplace actually improve my well-being? How does my boss feel about my safety and health? This slide shows the difference between what employees want in terms of benefits and what employers actually provide. I know this slide talks about the HR component of what we could offer in the workplace, and think about, the things that we generally offer are, being able to have time off to recharge, being able to take a break when we want, being able to have time to do physical activities. That is what workers identify as being important to them, but are employers actually providing that? So I encourage you to, when you have this integrated approach and bringing everybody to the table, the people that should be included should include workers, because they're a valuable tool in your toolkit. For those of you who remember this old movie, if they build it, they will come. That is the idea when we're talking about issues, policies, and programs to address worker well-being. We need input from workers, and there are ways to do that. There are now apps and software that let people choose their benefits, flexible benefits. So as a workplace, you could offer, education benefits or time off benefits or just financial benefits. And there are apps that allow people to actually choose which one of those they want, because maybe they don't need the education benefit, maybe they don't need the time off, maybe there's something else that's more important to them. It is a slide of some of the different metrics you want to look at when you're taking an integrated approach. The key is to include as much as you can from the very beginning, and you don't want to retroactively wish that you had captured a metric. You want to include this when you're planning your program and your culture initiatives. And there are examples of people that have done a program and ended up seeing results beyond what they expected. LL Bean, the company in Maine, they had a program to really improve flexibility and reduce injuries for their older workers, particularly in the warehouses. And they found not only did they reduce injuries, but people who participate in the program, which they could do during their paid time, they found that they actually reported losing weight and lower stress. And those were not originally planned by LLB, but those were outcomes that they identified. So that's an example of the importance of taking an integrated approach and really planning out your metrics measurements. I will leave you with this one slide. I think you've heard about the coconut oil guy from the Olympics. He seemed like this big overnight sensation, and how can he become so popular that he actually came back and did participate in the Winter Olympics as a skier. He's from Tonga. And he seems like this overnight sensation, but no, I mean, he made it to the Olympics. How did he do that? He did that through years and years of hard work, long hours of work. When he prepared to become a skier, he was training through all hours. He was finding people to train him. So this was not an overnight sensation. You don't just, see him at the Olympics. And the same can be said for safety and health. This isn't a 1 week, safety initiative. This isn't a 1 day stand down. This isn't this is Heart Disease Month. This is a long-term commitment. As Ron Getzel said, these are not random acts of wellness. They have to be systematic and long-term investments. I am going to just refer you to a couple of resources. Besides the great webinars from HealthLinks, NIOSH also provides webinars, also providing continuing education credits. If you want more information, please look us up. And we have many more resources. We have the website, social media, and our newsletter. Sign up for our newsletter to learn more. And the final thought here is, again, the vision that we will end our work shift even happier and with even more well-being than we started our work shift. Thank you so much for your attention, your interest, and your time, and thank you for all that you do for worker well-being. I'm happy to take any questions.
Thank you, Cha-Cha. That was a really great presentation. I enjoyed it. Please feel free to write in your questions. Sorry about that. My throat's messing up. I'm just going to move to the last few slides I had, but please begin to write in any questions. I saw some comments. People were just chiming in at how fascinating it was and just really enjoyed your presentation. But if you have a specific question, please feel free. Now's the time. Carolyn, I do see your question. Yes, SHRM credit is available. So in the follow-up email that I'll send out, it'll have a link to a quick survey that you'll take, which will then provide you the SHRM activity ID that you can claim your credit. Well, excuse me. So while maybe those folks are thinking, I just will point out a couple additional opportunities that we have for some live trainings. If you're in the Greeley area, next week we're going to be doing a family-friendly workplaces training. And then also next week, if you're in the Utah, Park City area, we're doing a creating a thriving, healthier workplace. So both of those links will take you to the registration and show you some additional information about each of those. And to answer your question, Ben, yes, the recording will also be part of that follow-up email. There'll be a link that will take you directly to the recording. And please feel free to share that with anybody that you'd like to share it with. So Cha-Cha, there's a question. Any thoughts about burnout? What types of specific organizational interventions can be put into place?
Thank you. That's a great question. I usually like mentioning that when we're on the first slide, when we're talking about supervisors. Really, I appreciate this question because there's a lot of talk these days about engagement and wanting to engage employees and how that increases productivity. And that is lovely, but the key is to not have over engagement. One study found that workplaces with transformational leaders, those are the ones who really inspire their workers, there was a linkage between that and increased presenteeism and absenteeism. And you see that particularly in like healthcare facilities and in the many different the government jobs, the nonprofit sector, the ones where people really care about their mission and they're willing to do anything for it, unfortunately at the risk to their own well-being. So that's a great question. It would be, again, up to the policies and programs in place to encourage people to take breaks as they need, to not take advantage of people's commitment and passion for their work. Again, think about the social workers, the teachers, all the people who really are dedicated and who probably don't get paid as much as some other people. I had an example I was going to say. This relates to the policies and the culture. There are companies that are now starting to look at whether people are actually taking their vacation time. Just like you've heard news about companies that don't allow people to check email, at night on the weekends, which I think it's up to you. I think people should have the choice of what to do. That's the key, autonomy and flexibility. But there are companies that have started, and some of these are like the startups you hear about in California, that have started actually including in people's like performance reviews. Oh, I see that last year you didn't use up all of your vacation time. What are you going to do this year to make sure that you actually take a break when you need to? Or there are companies that are giving people bonuses for using their vacation time, which sounds like an awesome deal. So yes, there are opportunities and ways to really encourage people to engage in self-care. And one key thing is, of course, to set the example the previous CDC director, he would each year go on a 1-week bike ride with his son, which doesn't sound enjoyable to me, but that's what he did. They rode around for a week. And there was one time he came back and he sent an email to all of CDC, and he said that when he came back, he had forgotten his email password because he took such a complete break. And he encouraged us in his email that he sent to the entire CDC to take a complete break and to take care of ourselves, because only when we take care of ourselves can we take care of other people. So great question about burnout. I think there's tremendous opportunity to change, to make sure that the culture is not rewarding overwork. That is sort of an American thing, right? We take pride in how busy we are. And I myself I have trouble sort of turning in my working time, because I feel like if I don't stay awake all night, if I don't work up until the last minute, then I haven't tried my best. So great question, and there is something that I think can be done about it.
Wonderful. Again, you can still feel free. We have a few more minutes. I will just take a couple more minutes to mention a few things outside of our upcoming events. I mostly wanted to mention, especially for those of you in Colorado, Cha-Cha talked a lot about perspective and making sure that employees' perspective aligns with what the organizational perspective is of what we're doing around total worker health. And a really great resource that we have for organizations operating in Colorado right now is our Small Safe Well study. And you can join our study and help us really learn about both organizational perspective and culture and the employee perspective. And to be part of that study, you have to have 500 employees or less, and you can have access to the Health Links assessment, as well as an employee culture survey and a total worker health leadership training, which really is making some great headway and helping leaders really understand more of what they can be doing for their employees. So just wanted to go ahead and put that plug out there. I see, again, lots of comments saying that it was an amazing presentation, Cha-Cha. So thank you so much for being on with us today. And be on the lookout, everyone, for my follow-up email.
Thank you so much to Health Links and the Center for your efforts. And we really need to focus on small businesses. We definitely refer people to the Center for leadership in small business interventions. So thanks a lot. And I appreciate the resources that you provide, not just in Colorado, but nationally too.
Thank you. And we, of course, appreciate you. So enjoy the rest of your afternoon, everyone. If you are in this blizzard, stay safe, stay warm, and we will see you next month at our next webinar.
Thanks a lot. Bye-bye.
Thank you. Bye.